Welcome to the Executive Lounge. I'm Ishira Ado, and as always, I bring you stories that inspire a new future. This is the Business Thought Leadership Program that brings you nuggets of insights from the lives and work of men and women who have scaled the daunting heights of running businesses or starting their own and just doing cool stuff around the world. My guest today is the Managing Director of Nyaho Medical Center, Dr. Elikem Tamaklo, second generation business leader, and we'll be talking quite a lot about his own passion, his own story, and the dawn of possibly a new era of businesses that transcend generations in Ghana. You're welcome to the Executive Lounge.
Thank you very much.
Finally, we get to have this conversation, but let me share first off with our audience what inspired the desire to have the conversation. I visited the Nyaho Medical Center on a number of occasions, and I observed how technology had been deployed, you know, from when you arrived, and you had to go do lab and do all kinds of, everything was, the process was aided by technology, and I was impressed. And I said to myself, I'm going to find out who runs this place. I want to talk to him and learn a little more. So well done with the Nyaho Medical Center. And, but how did you come to run the hospital your father started?
Well, it's been a privilege to hear about your experiences, and I've always seen it as service. And also really understanding the needs of our patients. And you know, when technology came as a big disruptor, I think looking at mobile phone technology, we're looking at 15 years ago, 10, 15 years, I think there's this sense that actually you could use it in healthcare to improve quality. And that's how I came to run the organization. This sense of the mission of improving quality healthcare. And so my personal story was that I didn't want to run the hospital. You talked about second generation, and my father founded Nyaho Medical Center, and that meant that I grew up, everything about my childhood was about Nyaho. And everyone I met was saying to me, you have to grow up and become like your father. And I think I personally felt that was a jail cell. I was like, my life has been mapped out and I have no choice. But I definitely had a conversation that changed my life with my father. He said to me that he would be proud of me no matter what I did. And at that time, I was wanting to do architecture. Wow. And medicine was like a second choice. But then he passed away when I was 15. And I think a lot of things happened around that time that made me feel compelled to do medicine. I felt like I didn't have a choice. But I also did not want to do medicine in Ghana because I felt that no matter what achievement I had done by myself, I would always have his shadow following me. And I didn't want to be known as Dr. Tamaklo's son because I really believed that I had a future and a destiny for myself. So I applied to lots of colleges, and I went to St. George's Medical School in London. And I think I'm very proud that I was able to go outside the country and achieve what I had achieved, because I think it helped build my own awareness of what I was capable of. And I realized I was capable of doing a lot more than just medicine. So I really led on education in the medical school. I used to do mentoring programs for young people who had not been in privileged homes, who had not gone to university, and gave a taste of medicine, so they could see that they could do it, they could achieve a bit more. When I graduated, I became an academic doctor, so I taught medical students as well as practiced medicine, and I really learned that I could build a momentum around people's understanding of their impact beyond just giving a service. It was, what am I put on earth to do? And then I worked for a charity that worked in schools, and I did a lot of different things. So just to show how that leads to me coming back to Ghana, I had my own personal experience, and I want to stress that for anyone who's been in a family business, that compulsion to work in the family business is very strong. But I think the only success happens when you identify your own personal mission. And my personal mission was when a friend of mine had come to Ghana and had unfortunately been through a lot of lapses in the system and died as a result. And I think comparing my own experience in the UK, I just could not sit still to see nothing being done. So I definitely saw the privilege and the honor of what my father had built, and my mother had been running Nyaho Medical Center, and I saw it as a foundation. So for me, it was a privilege to come back and, you know, unlike other people starting from scratch, I was able to start from a platform that had already been built. So for me, it was, what is the value that I'm adding, and how can I really do that well? And that's where the technology bit comes in.
So you talked about an experience on the other side of the Atlantic. How was that connected with the situation that saw your friend dying because of lapses in the system?
So it was in 2009, and I was working as a junior doctor in pediatrics, and I felt ill. I just didn't feel too well. So I went home, and you know, I was in bed, then started to get central chest pain. And being a doctor, I kind of thought, okay, something is nothing. So I started to just think it was heartburn, and took some tablets. But then it started to get heavier and heavier, and started to get more like what you would expect from someone who's having a heart attack. But in my mind, I just thought it can't be a heart attack. So I called my friends, and I spoke to a friend, and the friend said, call an ambulance. And I was like, I don't need an ambulance. But then at this point, I was on the floor. So he called the ambulance, and within 10 minutes, the ambulance was there. When the ambulance came, they did an ECG at my house, at my doorstep, and that's when the ECG showed or looked like I was having a heart attack. And in Liverpool, you get routed. If you have specific findings for a heart attack, you get routed to the Liverpool Heart and Chest Hospital. So I was taken there again within 10 minutes. I mean, the whole experience was very quick, but very vivid in my memory, because I saw a cardiologist as soon as I came in, and he also could not rule out that I was having a heart attack and just could not understand. I was too young. But then I had an angiogram where they look into your heart. My blood pressure was really high, and I had to be admitted into the high dependency unit. And all of this was just so weird. Actually, the thing I remembered was the nurse. I don't remember her face, but I remember she was blonde. I remember her hand on my hand and telling me that it's going to be okay. And I think for me, I was on the other side as a patient, and just that empathy was because I was alone. I didn't have any family with me, and it was all very scary. So I had all of this happening, and then finally, they'd done so many tests. They gave me a diagnosis that I had hypertrophic cardiomyopathy. Basically, I had a condition that meant I could die at any point.
Why? Your heart would just stop beating?
Just stop beating. So it's very common, I think more common in footballers. When you see a football game, and then you've heard of some stories where the football just all of a sudden drops dead. And it's a very rare condition. But that's a condition that they thought I had, and I had all kinds of restrictions. I couldn't get my heart rate above 100. I had to start taking antihypertensives, and I was 25, so I was quite young. All of this was happening, and after 8 months, after so many investigations, and having a cardiologist from America who was a specialist in that field, it was ruled out. But I had so many investigations to come to that point where I was given not a totally clean bill of health, but that diagnosis was not the diagnosis in the end. And at the same time, a friend of mine who was visiting came to Ghana and had gone to one hospital, a smaller hospital, and had not had a number of investigations done. Simple investigations, and I think they thought it was malaria, treated him for malaria, and it didn't get better. And again, went to a different facility, and this was not the flow was not continuous, so they thought certain things had been done. A lot of assumptions in the care to the point whereby it became so bad it went to Kolobu, but again at Kolobu, it was not picked up in time until it was too late. And he basically had an infection that had spread throughout his system, and it was too late by the time they realized. Now, my understanding of healthcare is that simple things are simple. And really, in Ghana, I look at the challenges we have in the healthcare system, and it's really that we're not doing simple things well. And I look at the UK, the contrast with my experience. In the UK, I had the best services. I had a cardiac MRI, I had ultrasounds, I had contrast echoes. I had so many things done to me. I just could not reconcile, why is it different, my ability to survive depends on where I live. If I was traveling, no matter, this is the equalizer, no matter who I am, if I was in South Africa, if I was in Ghana, my chances of survival is dependent on where I'm at any point in time. So for me, I just felt that Ghana deserves more, Ghanaians deserve more. That was my father's mission. It had not been fully achieved. And so for me, I had to question, what is my role in this? How do I create a system that can grow so that we can deliver on the promise to patients? So it's definitely a journey, but that's how I came back to Ghana. And that was a contrasting storyline between myself and my friend.
Wow. So you had this experience and, well, for the lack of a better expression, led to an epiphany.
Yes.
And it created a sense of urgency. Do you think you would have had that sense of urgency if you just carried on along, still questioning, how do I live out my destiny?
Yeah, you know, it's a very interesting question. Would I have been different? Would I have made a different choice? You know, I can't answer whether I would have, the timing, whether I would have come to Ghana now, but I definitely felt this sense of injustice in the world. So I was looking at working with Médecins Sans Frontières, and I'd already started to work towards that. So I'd done a diploma in tropical medicine because I had trained in the UK, so I can't expect to go into a tropical country and know how things work. So I think I was always moved by injustice in healthcare. And so at some point I probably would have done something. But whether I would be the one doing it or whether someone else, I can't say. But I'm also fascinated with design. And I've spoken to you before about my passion for architecture. But I believe in the design impacting on the outcome. And I think a lot of times the system is designed to give you what you're getting. So it's always going back to the system and designing it. So for me, coming back to Ghana, what I'm doing now is kind of stripping back the system, realigning it to what are we trying to achieve, and then trying to design it to achieving that.
It's interesting you mentioned, you know, systems being built with the outcome in mind. So let's juxtapose what you're trying to achieve at Nyaho and onto the healthcare system we have in the country, generally in the public space. What kind of learnings do you think that need to be, that should impact on how we really build a system that saves lives?
I've thought long and hard about this, and my mind is still evolving. 3 years ago, we started the Dr. Elikem Tamaklo Medical Symposium. It was supposed to be just a one-time thing marking our 45th anniversary, but we brought all the stakeholders in one room: the private sector, the public sector, the regulators, the insurance bodies. And the conversation that came up was really interesting because people realized that they had not really talked about these issues together. And so we started this as an annual symposium, and it's grown and grown. And what has been interesting is realizing that actually the first step in the design is that we have too much fragmentation in our system. So we have the Ghana Health Service that focuses on the public sector, but then the Ghana Health Service does not focus on the private. You have the Ministry of Health that has policy, but then in terms of engagement, who is the voice of the private sector and the public sector? I mean, how do you reconcile so many different entities? I mean, we have about 30,000 healthcare institutions.
Wow.
And this was from the head of the regulator mentioned that statistic. That's a lot of entities. So how do you find a way of streamlining the expectation, the minimum expectation? That's the first challenge. The first challenge is to find a way of standardizing, at least from a basic level, what should happen for all patients. And I think a policy is one thing, but it has to be executed. So I think the second step is about execution. Once you've got this clarity, it's got to be executed. So who is enforcing? And I definitely, my heart goes, I do believe there's a lot of work, and the hospital, the healthcare facilities regulatory agency is very under-resourced, so cannot act fully in its regulation, in its regulatory capacity. So people get away with no one watching and no one holding accountable. And so that's where the role of the patient comes in, because I'm a big believer that patients need to hold healthcare institutions accountable and doctors and nurses accountable. Now, I know there's a fear that if I raise my voice, I might not get the care I receive, and that's a reality. But I do believe that everyone has to start speaking up and talking about these issues, because if we don't talk about it, we can't find solutions for. So I think that's where I believe the fragmentation is not good for us. Yes, the role for private sector is there, and private sector cannot be ignored. But the public sector, it can't all be about public sector. And we need to try and find out, at the end of the day, the patient, the Ghanaian patient, can go to any facility. There should be a basic minimum expectation. So I guess that is where I'm focusing on how do we start to bring these conversations up.
Let's move away from medicine for a moment and go back to your own personal story. You tried to evade what eventually I would call your destiny, which is still evolving. You know, but what fascinates you about design that actually made you want to do architecture?
Where do I start? I think there's something about design that if you look at human beings, we love experiences. We love seeking out great experiences. And in the subconscious, when you enter into a room, you feel something. Now, whether you're aware of it or not, you still feel it. So how do you build a system that can give you the same result? It's intentional. It's not by chance. How do you design something so that if I designed it so that you feel safe and comfortable, that when you come in, you actually feel safe and comfortable? That's a great design. So I'm fascinated by all these big buildings and these interesting spaces, especially when they were designed for a purpose. So moving away from architecture, I'll talk about Ghana and I'll talk about architecture. I know you've spoken to a number of architects.
That's right.
But it goes back to our resources and how we're using our resources. Because I look at a tropical country, we have a great country with lots of scenery. But if you look at the old buildings, they were built with long, trying to create shade, and also trying to make sure there's air passing through. I don't believe that we should just look and copy what's happening in the West with glass. Because glass can magnify, like a magnifying glass. You need to put in air conditioning. Air conditioning will increase the cost. And we know in Ghana electricity costs are high. So I'm beginning to, my mind is starting to think about, okay, Ghana, how do we, you know, what can we do with our natural resources to harness it? So in the hospital, as a business, I think that every business has to look at who's their stakeholders, who's their patient, and what the patients want. So for us, our patients want a peaceful, calm environment. So as we design, we have to start saying, if we're going to build this new consulting room, or if we're going to do anything, we have to start asking them, what would they expect? So that's how it's featured in our decision making. So I'm excited to say we've used it in our Octagon branch. We looked at all the lessons to learn from airport, and we interacted with patients, showed them different designs, and asked them how do they feel if this was the case, and really involve them in decision making. And then we said we wanted it to be peaceful, we wanted it to be inspiring, we wanted people to come in and feel hope. And now when you go in, the design is such that you have a breadth of inspiration because of the images that come to you. And people have said that to me. They come in and they feel calm. There's actually music playing in the background, and it's soft music. And that's not by chance, because they're coming in because they have a worry. They're anxious. They want a solution. So it is our duty to make them feel calm so they can listen to the doctor and get everything they need.
Wow.
So.
Interesting stuff. So it's all put together for a specific outcome. And in coming to or recognizing what that outcome is, you've consulted broadly.
Yeah.
How important is getting your team to understand the essence of what they do, albeit, I mean, in terms of scale, everyone playing their part, be it big or small. How do you get them to understand that there's a greater essence in that small task you must perform on a daily basis?
Someone said to me, culture eats strategy for lunch. I believe it, because you can have the best strategy, you can have the best plan, but it requires people. And I think that sometimes we take for granted the diversity of the people we have in our organizations and the ability to really contribute to the plan. And so the way we started, for me, was really to start engagement and come from a place that I'm not on the front lines. I'm one human being. And I give this analogy of a mountain. My role as the managing director is a positional role. Everyone is equal. But based on my position, I can see what's happening around the mountain, but I can also see what's happening in the horizon. So it is my duty to shout and say, there's a storm coming, everyone needs to build strong houses. And I need to do it in time so that when the storm comes, we are ready. But then the person who's on the ground, at the very bottom, also has a duty, because they can see the grass. And if there's, let's say, an armyworm infestation, if there's a problem, they need to be empowered to shout out, hey, there's a problem. If we don't do something about it now, it's going to affect all of us. Because by the time the person at the top sees the devastation, it's too late. So we started a process of cultural change, which really involved empowering every stakeholder, every person along this chain. And I always talk about honor, which is from our Nyaho way, but honoring people is honoring that there's the security man. If the security man does not do his job, a patient coming in might actually start to have a negative experience from the very beginning. By the time they get to the doctor, the patient is in no mood to communicate about what they're going through. They're really stressed and they're really worried. So if the security man is not playing his part, it affects a doctor's outcome. If the client service is not booking properly, then it affects the end goal. So everyone is connected, and that's where honoring each other. It's about mutual respect. It's about understanding that everyone can contribute because they all see things from a different way. And the cultural change is not easy, because I believe our system is very hierarchical. And there's no problem with hierarchy, but it's really about how do you empower the very least to contribute and to be a citizen. I think we talk about citizenship, that they all feel that this is I'm part of this. So anyway, we focus intentionally about culture. It's taken us 3 years to, I think, see this big ship move. And I think if you go in to change culture, you can't think short term. It's really foundational. And so it really starts slow. But then I definitely think the momentum is like a ball rolling down a mountain. It picks up moss. So that's what I think we're trying to do.
Fantastic stuff, and great lessons so far. We're going to take a break, and when we come back, we'll be learning more from Dr. Elikem Tamaklo, Managing Director of Nyaho Medical Center, who's my guest today on the Executive Lounge. Don't go away. Welcome back to the Executive Lounge with me, Inshira Ado, and my guest, Dr. Elikem Tamaklo of Nyaho Medical Center. The life of a business leader today, I mean, you're changing the culture. It's not an easy job. it's been 3 years of consistent and persistent work at it. Does that take a toll on you at some point?
Very much so, actually. I have to give a lot of commendation to my wife, because I definitely think that without a strong support system, it's very hard to achieve so much in so little time. And when I look back at the change we've gone through, it's a lot of change. I think I came in as a change agent. And so within 6 months, we had implemented an electronic medical records. We had expanded consulting rooms. After a year and a half, we had actually started with on-site clinics, and we opened a satellite clinic about 8 months ago. And so all of those are great to see that we've been really pushing the bar. We have implemented patient care advisory councils and done things to improve quality. But the knock-on effect on myself has been this sense of neglecting myself. And I think it's consistent with most leaders who are very passionate. I remember coming in and, hearing about our statistics with, some areas of poor delivery. I put everything, all my energy into sorting that out and trying to improve it. But then this is when we were moving back to Ghana, and my wife was pregnant with our first child. Wow. And my wife is not Ghanaian, but my wife was told by everyone, Ghanaians and non-Ghanaians, why was she giving birth in Ghana? I was running a hospital where patients have come, and we've had patients who've delivered their children, and their children have also delivered their own children. And as I was looking at it, I was like, no, the organization has to be such that what is the best care is the best care, regardless of who it is. And so when I came, I just thought, okay, well, if our own system, if our own people can't trust the healthcare and from delivery, then there's a lot of work. So with my wife delivering, I started thinking, okay, as an individual, what is my role? And so we started pushing and pushing. So I was replying to emails late at night, having long meetings. I wanted to set the tone. So if everyone was supposed to be at work before 8, I had to be at work before 8. I was last to leave. Most times I skipped lunch. And most weekends I was working. So what happened? Well, my stress increased. I started putting on some weight, and we did an annual health screening, and my blood pressure was high and my cholesterol was high. And I know better. I mean, I think I've worked in high stress environments. I've worked in emergency medicine for a long time. And even in that time, I continued going to the gym. I was very high functioning. But when you're responsible for people's livelihoods, when you're responsible for employees, you're responsible for patients who are coming in, their loved ones, 24/7, the stress really gets to you. So there were some lessons I learned in that period of time, and that I'm applying now. And I'm really empowered, and I'm glad to see people who are empowered about their health. Because I think the first step is awareness of the situation you're in. And when you're leading, that is not a normal situation. You are responsible. And that means that you have to be able to address anything that comes up. So I think prioritizing myself started to become a theme. I needed to make sure that when making decisions, I could make the best decisions. I was not tired. I was not fatigued. I was not stressed. And that meant I had to get a coach.
Wow.
I got a coach. I actually have a few coaches who give me that feedback and that perspective, to help me continue what I'm doing. I have a support network of CEOs, of young CEOs who are going through similar challenges of having a young family and trying to do something that's ambitious. And then I also have deep faith. I go to church and I meet with my pastor, I meet with people. We have a home group, because at the end of the day, when you're going through a lot of challenge, you have to increase your support. and my family are there. And so I didn't realize this in the beginning, and I think that now I'm beginning to see a theme that actually, yes, prioritizing myself is for the best option for the organization, because I need to sleep well, because when I'm coming in to work and there's a crisis, then it's all systems go. I need to be ready to run. So I'm not saying I'm perfect, and I'm not saying I've overcome all these challenges, but I'm very passionate about this because I always ask myself, what is going to happen if something was, if I was to die, God forbid, but if I was sick, what will happen to the organization? Will it still run? And I think a lot of times, a lot of leaders, the organization's success is dependent on them pushing and dependent on them really driving the change. So it goes back to our conversation about culture, that for me to be freed up, I need to be able to create a culture where everyone's empowered to all believe and everyone has the same mission, everyone comes to work empowered. And that leaves me free to deal with only the things I have to deal with. And the most important thing is family. So I now have a 2.5-year-old daughter, and her name is Joy. And I think that you have to find joy in the tough times. You have to find an anchor because the tough times come. And I've dealt with a number of big crises. I remember when the Doomsaw Challenge, as a hospital we have a backup, we have generators, 2 generators. But with Doomsaw, we're running on the generators a lot, and you're running 24/7, and you have a theater. What happens when your backup fails? So now we have to think of a backup of a backup. With water, when water was not coming, we're a hospital, so we run on water. You have to keep it clean. So we would buy water and buy water. We built a borehole, reverse osmosis, to make sure the water coming out is actually pure. And these are all the different times where we've had to go through these challenges. So I think I'm passionate about seeing leaders empowered about their health and about stress. Stress affects your hormones and your chemicals in your body. So your chances of being sick in the future, even if you can continue at that pace, it's like an engine running 150 miles per hour. At some point it's going to fail. And so I'm very passionate about leaders and people who are in really responsible roles, really prioritizing themselves, prioritizing their health and their well-being. It's about their mental health.
In your line of work, you talked about, you've done some emergency medicine as well. And a number of times, and I was having a conversation with someone recently, and if you look back at some of the stuff that have happened in the country quite recently, people, and when I say people, I'm referring to first responders to an emergency, with good intent, actually sometimes end up exacerbating the situation, or even speeding up the process that leads to fatalities. Are we empowered enough? If not, what do we need to do differently?
Well, it's always easy to point fingers and say, the government needs to do more, or hospitals need to do more, doctors need to do more. But I think ourselves, what my response to that is about basic life support is easy. It just means that you need to find out, read about it. What do you do in that situation? Basic life support. You see on the television people who are doing CPR. And you see they're coming from all over the place. They're not just first responders. They're people who have done the training. So I definitely think that there's a role each of us has to play. But at the same time, it goes back to regulation. It goes back to who's holding accountable. If you're offering an ambulance service, if you're offering a first response, you need to be held accountable to what you're doing. So I did emergency medicine, and I worked in the Royal Liverpool Hospital, which had the largest A&E in the north of the UK. So it was huge, inner city. And you're getting gang violence, you're getting football matches, the violence that happens when Everton plays with someone else, or Liverpool. You're getting all kinds of things coming in. And it's simple. A, B, C, D, E. Airway, make sure the airway is clear. B, breathing. Are they breathing? C, is their heart rate, is their heart pumping?
Mm-hmm.
If at the end of this your heart is not pumping, then you start CPR. But sometimes you start CPR without looking and you see that there's something inside your mouth. So simple things are simple. So as long as you have a system and you follow that symptom, A, B, C, D, E. D, E is really for doctors, but A, B, C is simple. Airway, breathing, circulation.
So these are protocols that are taught widely, but not here. And like you said, simple things are simple, but I guess they're only simple to the extent of exposure and empowerment. How can we empower people?
Okay, so I think empowering people, I would love to see a lot more in terms of the television, in terms of entertainment. I'm all for it. But there were days when I used to remember seeing public health notices on television and seeing that there was a concerted effort to educating the layman on radio. And so I actually think that there is an opportunity for us to start looking at the content on our TVs and our radios and start using that as a platform to reaching people. Mm-hmm. But simple things as well, WhatsApp. So as a hospital, we started the Healthy Living magazine. If you go to the Nyaho Medical website, you'll see there's a Healthy Living magazine that's really about empowering us to know about the foods that we have, the amazing food. Contumely is amazing. Like spinach is really good. Mm-hmm. But we also have a lot more green vegetables. And so there's so many different things that we can do as an entity. So I think that's where Nyaho was looking at sharing. But I think also when we have our public health days, I was very proud of the breast cancer awareness. We gave free health screening for over 1,000 women. Wow. For breast screening. But it was also great to see other businesses really doing their bit. Mm-hmm. And so I see business as a force for good. And I think every business should start thinking about, how are they engaging on that. Simple, just tap into what's happening. There's always a public health day. Mm-hmm. And then I guess also we can do better. I mean, doctors and nurses in our communities and our churches. I'm really, and even the mosque, one thing I've seen in terms of religion, it brings people together. Mm-hmm. And I would love to see religious leaders also driving that healthy living mantra or that empowerment mantra for health. I believe in prayer. I believe in the power of prayer. But I also think that simple things are simple, and so we can empower everyone to think a bit about what you're doing.
Overall, where people are more empowered, what have been some of the outcomes per your observation?
Are you talking about patients or?
Yeah, patients and life in general, and wellness.
I think that initially the person who's empowered is afraid. Samuel L. Jackson quoted another person. It was in the movie, but it was our greatest fear is not that we are weak. I'm messing this up, but that we are powerful beyond measure. Mm-hmm. And I think that when people are empowered, the very first thing is actually being afraid of their own power. And I think that we have to get past the fear of knowledge, of being empowered. What will people think of me if am I too known? Will I be seen as proud? Actually, if I'm a woman and I'm trying to take a leadership role, this is where it's really important that we start to look at the bias. Mm-hmm. That why do we think a woman is being disrespectful if she's really standing up and being assertive? And so, yeah, when it comes to the first step of overcoming that fear, I think we have to get over that hurdle. But once you get over it and you realize that actually, you know what, I have a role to play and I'm taking up that role, then it starts to change and you start to change things around you. People start getting light bulb moments and epiphanies. So I see my story is one that I want to share with people to encourage them that, yes, I grew up in this environment and I had this opportunity, but I did something with that opportunity. I'm always inspired when I hear of other people's stories. So I want to start hearing more stories. And I think that's where we'll start to see a change in our country. Storytelling, I don't want to say we've forgotten some of the old traditions. But I remember Anansi's stories. I remember about the fireside. I remember that these stories taught the society on what their roles were and what their expectations are. So I definitely think we can do more storytelling and focusing on the right stories, not just taking stories from the West, from locations that are not relevant to us. I think behind us are pictures of Kwame Nkrumah now. I want to hear more of the real stories, not just when he met the Queen, but I want to understand what was it like when he was having to make tough decisions, when he feared everyone would be against him. And I think what you're doing is commendable, because I think the more people become open and share their stories, and I want to be authentic, so that's where I'm telling you that I'm a work in progress. I don't have it all figured out, but I'm humble enough to ask the question, and I think that's what I want for everyone.
Wonderful. So I'm still asking questions, and I'm learning as we go along. See, it's nice and admirable to admit that you're work in progress, and also to look for help when you need it. Is that something, and I can tell from your experience and from other people's stories that it is beneficial. But I could make this safe assumption that we're not seeing the true effect of that lifestyle or choice and decision making to be humble enough to learn and also continue to be driven in the general sphere of leadership in our country. Why are we unable to, in your opinion, to tap into such a great gold mine if it works, and a litany of examples around us?
So you're asking me tough questions. Because I can only talk from my experience, and it's limited, but I think the stories are there, and I want the platforms to be louder. So I think we all know about Patrick Ewa, and I had the opportunity of meeting him about a few months ago. I was struck by how soft-spoken and how humble he was. And when you listen to what he's done, it's not been, it's some bold things. Yeah. It's like, you know, he's gone and he's really broken some ceilings. But at the same time, his whole mannerism is very counter what you see as the big man. So, I mean, I think definitely we can't allow other people outside of our country to lord him up. And in our own country, we're not doing the same. So I think that whereby there's a disconnect, our platforms need to become bigger and louder. I think just giving awards, I think that awards is got to have meaning. And so I definitely want to understand why someone is winning an award. I want to understand why that person stands out. And so that's when you can then, when you start to explain, you can see, is this quality or not? So yes, maybe a bit more of a platform that people can look at. But I also think people need to be more real, and I'll start with myself. I mean, I think I'm young. When I say my age, actually, people are always, when people see me, they always think, oh, Dr. Tamaklo, I expected you to be older. But in coming to Ghana, I understood that I was young. I understood that I was going to be working with people who were a lot older than I was. So a few things were important to me. One, I had a coach. But two, I needed a strong board. I needed to have that system. The governance of the organization needed to be strong so that it could counterbalance my youth. And I don't even want to say my age. But
it's all right. You're under 40.
I'm under 40. So, but at the end of the day, it's just about experience. And I think when I started to look at board directors, I started to see, hey, there are people here. I started to discover people. So I really believe that, okay, awareness of self is important, but awareness of other people. So if someone is loading themselves and someone's big, well, what's our response? Do we just allow that to happen? It's a challenging thing. And in our hospital, I, as the leader, have to set the tone from the top to the whole. So if I have a manager who's coming in and is squashing down, I try and keep it very open. So I will say what I think. And so whereby I disagree with the approach, I will call it out. Always harder when you're not in your own environment to do that. So I would say start from where you are and model the behavior. Be aware of yourself, be aware of your limitations, manage it, and then also be aware of other people and then manage that. So once you have a value system, and I think for Ghana, my hope, I believe in Ghana, I believe in what we're trying to achieve, but I think we need to be consistent to our values. Once you're clear about your values, then you can judge every action against that value and say, is it consistent? And if it's not, you do something about it. So that would be my take on that.
Fantastic. We're going to take our final break. When we come back, I'd like to explore the value-driven existence and then the concept of business for good, how we can find a nexus between the two to drive growth. And for you, don't go anywhere. We'll be right back. Welcome back to the Executive Lounge. This is the final part of what looks like the first conversation with Dr. Elikem Tamaklo. We're, by that, inviting you to come back another time for an extensive chat. The idea of living by values, developing a value system, be it for business or for individual or at home, is something that we can't overemphasize. You said something about how it's important to know yourself and be aware of other people. How does the concept, well executed, impact on business?
So I know every organization has its own set of values, and the question as to whether it is consistent and well executed, it lies with the stakeholder, with the person who's using the service, and to the employees. So where there's a disconnect, then there's a mistrust, there's a lack of trust for that entity. And the end result of lack of trust is actually when there's an alternative, people go to the alternative. So there is a business case for living according to the values that you state. So in Nyaho, we have patient and family-centered care as our value system, and we changed that because we've always had patient-centered care. But we realized that our patients were not coming alone, they came with their families. And the family sometimes cared more about the patient than the patient. Patient would be, oh, don't worry about me, don't worry about me, but it's actually the mum or the daughter who wants to see the best care. And by changing that, all of a sudden, how we run our system changed. And a number of the initiatives that we have planned for the rest of the year and for the next 2 to 3 years stems from just that one value. Because once you start to say you are patient-centered, then yes, you are judged according to that. But when you're saying you're family-centered, everything about how you do business has to change. So when you come to a reception, do I have space for my child? And so these are challenging. Once we put up our values, we knew that, okay, this has to become our core plumb line by which we judge any decision moving forwards. So I think that's where, by understanding your values, it starts to feed into your actions, into your strategy, into your plans. And then, well executed, the patient will judge you based on that. And we changed our vision to be Africa's most trusted name in healthcare. And 2 things I want to say in that. Trust was central to that, because healthcare, at the end of the day, you're trying to create a culture of trust, that a patient can come and talk about the most intimate parts of their lives to someone else that they've probably never met before. They have to talk about things that they would never even tell their friends. So it really requires a culture. It requires me to trust that you will hold my information, do something with it. So Africa's most trusted came from where we realized that Ghana, yeah, maybe in 5 years we can become that. I mean, right now, how do you judge that? But some people might say that we are, some people might say that we are not. But at the end of the day, we want everyone to say that. So yes, we can work towards that. But what is that big ambitious? Why, if it's about trust, it's about human beings, then why can't we do it and become a beacon of light for the whole of Africa? If Ghana was the black star of Africa, then surely we can also take on that mantle. So I think the business case for it is that if people identify you as authentic and true, and it's a true value, then I believe that you'll start to see people paying for that value. And that's where it becomes sustainable. So value creation for me is not about finances, but at the end of the day, if I'm willing to pay for it and I see a value in that, then it means that you're doing the right thing. So that's why I believe in value driving business.
So it's a fantastic concept, but like you did say, the stakeholders, the people who will execute the value system or the values are the stakeholders, and the key in that value chain of stakeholders are the employees. And they're human beings, dynamic, emotional, rational, sometimes irrational, which means that you're not going to have a smooth... so what have you put in place, or what should a business that's looking to have a cultural shift put in place to ensure that overall you will have more uptime than downtime? Yeah.
No, I think it's a good question, because we are asking that every year, every month, every week, because it's all about people. And actually we tell our staff that, hey, when we say patient and family-centered care, it's not us and them. Actually, it could be your mother, it could be your father, it could be you. And that's really when it starts to be personalized. But in putting the structures, it starts with the people, and so we have to hire according to values. It's not, if you have someone who's got a great CV, has got all A's in school, or is amazing, I mean, I think it's quite clear that that does not work, because they can work anywhere. But there's got to be an alignment between the personal value system and the organization's value system. And I think that's where you can recruit for values and train on skill. And I think I believe that ethos. So our recruitment processes are strengthened, and we're adapting and changing every time. So we went away from just having the straightforward interview to having a bit more of an experiential. As you go around the system, different people are going to be interacting with you, and they're all going to be feeding back to the interview process. And so we started to think about how do you assess someone on values. It's very difficult to do it on a one-time sitting. So we then said we want to have multiple sittings. And I sit on all interviews now. I don't sit at the beginning, I sit at the very end. And we say we recruit by consensus. So everyone has got to agree that this person's the right fit, including myself. So you can do the shortlisting, and when you feel that it is the right stage, then I have a 15-minute interaction with the person. And at the end of the day, it's my responsibility to ensure that we get the right people who have the right value system. Now, for the people who are already in, there's definitely an awareness that it's not saying you're good or bad, it's just saying that are you aligned to the organization? Is this where you are supposed to be? Maybe that this is not the right time for you. Maybe you're actually supposed to be somewhere else. So our performance management system became a performance culture according to values. So when we're doing performance management, it's not just about have you achieved your goals. It's also about how did you achieve your goals. And so our values are in the form, and we're starting to actually ask the questions, okay, how are you on these areas? So we want to strengthen that so that at the end of the day, everyone's aligned that, hey, we're here to deliver value. We have our own value system. If you want to be part of this family, then we're all going to live by the same rules. And it applies to everyone. So myself, the directors, the managers, the staff, we all have to abide by the same rules. So I have to put in the same leave requests to take my leave. I have to, and actually I was taught a lesson. We really emphasize taking sick. If you're sick and you're genuinely sick, you should take time off. I want to work whilst I'm then, and the medical director told me, Dr. Tamaklo, you have to go on sick leave because that's what you're asking other people to do. And so seeing that accountability is part of the cultural change, that you have to be consistent to your value system. It takes time, and so I'm saying that we're not there yet. But we have improved, and I'm really glad to see some of the changes that have happened this year. I believe it will take 3 to 5 years for us to see it consistently. But definitely every organization has to really intentionally look at their people, prioritize their people, and make sure that they they enjoy their work as well. That if your value system is about creating value for stakeholders, it's also for your employees. So you might not be able to pay the most. I'm very clear that we don't pay the most. We try and offer an experience that you can learn, and we want to create a learning environment. We want you to leave better off than you came in. So we started Fitness Fridays. And we do an annual health screening now, whereby we realized that a lot of our staff were overweight, a lot of our staff had high blood pressure, and our responsibility was, okay, what do we do about it? We can't go and advise people if we are not advising ourselves. So in our lawn, on a Friday, we start Fitness Fridays, and the champions are the directors as well. So I'm there, and everyone is there. So wow. It's quite fun.
That's interesting stuff. Well, unfortunately, that's all time would allow us. It's been an insightful conversation, but then again, we've already agreed we're doing a second part to this one. So again, thank you so much, Dr. Tamaklo. 5 takeouts from today's conversation with Dr. Elikem Tamaklo is, number 1, is that sometimes life will deal you a blow, and that blow has a lesson and can open a window into your calling or to a next chapter of your life. And so wherever you find yourself, always look for that silver lining. It might be a lesson, it might be an epiphany that opens your consciousness to new possibilities. Number 2 is that you must have a sense of responsibility. As a leader, you have a responsibility to know what's happening around you, but more importantly, as he says, to see the horizon and be able to tell people where you're going, and more importantly, the dangers that are lurking in the near future, so they can be better prepared for it. Because as a leader, you're not living for yourself, that every decision you take affects all the people who are in the value chain. Number 3 is, and I'll quote a phrase he uses, culture eats strategy for lunch. You must be deliberate about developing a culture that carries the values of the vision and keeps it alive. If you don't have the right culture in your business space, you can have the fantastic ideas, the great inventions and disruptions, but the lack of culture will bring it all crashing down. Number 4 is that you must be accountable. Set systems of accountability in motion. The rules you make, you must live by them. Because if you're not showing people that the rule touches and applies to everyone, then you create room for dissent and mutiny. And the final thing is that design is important to everything you do. And design is not only about drawings, but it's also about thinking. It's about how you position things so that they impact on the overall outcomes. So whatever you do, think about what actions you're taking today and how that interfaces with all the other things around you in the environment to deliver the outcome that you're expecting. I hope you've learned something from today's episode. We'll be back with more. Thanks again, Doc.
Thank you very much.
And for you, thank you for tuning in and watching another episode of the Executive Lounge. Go forward, make rain. Shalom.